Dr. Joel Ferman and Dr. Cara Fuhrman. Welcome to the Fieldswell Podcast.
Great to be here.
Thank you. We're excited.
I'm so happy to have you here. I recently visited your new practice, Longevity RX, and you are two visionary clinicians and leaders in the field of nutritional science. And I can't wait to dive into what you're creating and expertise each of you have in the field. So, welcome.
Thank you.
Dr. Joel, why don't we start with you? Tell us a bit about yourself and how you got into the work that you do today.
I've been doing this for more than 30 years. I went to medical school with a specific intent to be a physician specializing in nutritional science, nutritional medicine, and reversal of disease through nutritional therapies. I became a board certified family physician, wanting to treat all ages, but with the intent of not to be just like a regular doctor, but to be able to remove the causes of disease. And through my career, I've treated thousands or hundreds of thousands of people and reversed conditions like psoriasis and rheumatoid arthritis, and having people with dementia get better, and having people no longer diabetic. Their type 2 diabetes goes away, their heart disease goes away, their blood pressure comes back to normal. In other words, most what I've been doing is deprescribing, taking medications away from people, not giving them more medications, and having them get well through nutritional excellence. And then I've written about 12 books, 7 of which have become New York Times bestsellers. I've been lucky to be president of the Nutritional Research Foundation. So we produce nutritional research, spreading our work to scientists around the world. And I've been very blessed to have a series of television shows on PBS. And some of my most famous shows, like Three Steps to Incredible Health in 2012, I've raised over $70 million for public television with my numerous public television shows. We're very extremely successful. They sometimes still show it in the middle of the night. Like people saying, I'm in my hospital bed and I'm watching you on television talking about this or that. And I came, and it sparked me to buy a book, and now I got better, so people watch me. So PBS has told me that they've shown my show in reruns so many times that have been on television more than Oprah has. So
Wow.
that's how many times I've been on, it's like, I was like, wow, it's like, that's all
Yeah.
the reruns. So,
Yeah.
yeah. So we're, Cara and I, now that
Mhm.
my daughter's a doctor too, we're very excited about opening our new practice right here on San Diego Road in Rancho Santa Fe, because combining with nutritional science and the advanced amount of the portfolio of foods that prevent and even can treat cancer and heart disease, and the advance in supplements that we can modify, biochemistry of the body. And we also have these new regenerative technologies, and we're at the forefront or the cutting edge of new things that can enable people to get well without taking drugs or exposing yourself to radiation. A good example is a woman who has weak bones,
Mm.
osteoporosis.
My grandma.
Yeah. So instead of taking a drug that can cause heart attacks now, or a drug that can cause atrial fibrillation, we have electromagnetic therapies. In addition, we can measure people's bone density and fragility without radiation, and then we proceed to strengthen the bones and fix it with equipment, with regenerative equipment. And so, of course, we're giving them good nutrition and exercise,
Mhm.
but with our regenerative equipment can actually build back new bone mass to strengthen bones.
Mhm.
So we have all this new technology, and it's really exciting to combine my life's work with these new technologies and even new nutritional input from my daughter too. And so combining all these things together in one practice has really been exciting, because we have so much, you could say, tools to help people, so many tools to take away, including removing people's pain from like frozen shoulder or meniscal injury of the knee or spinal stenosis in the back or Achilles tendonitis, or we can actually fix joints and remove osteoarthritic joints and build back cartilage. There's just so much technology where you don't need to have surgery, you don't need to take drugs. So the term longevity RX is broad, but it's about living longer, but living feeling good and good health, enjoying your lifespan and your play span and your health span,
Yeah.
being able to enjoy your life without pain and into our later years. So we have a lot of new stuff that's really cool.
It is.
Yeah.
It's really exciting. When I visited, I don't know what I was expecting, but you're seeing things like, red light, hyperbaric,
Mm.
PEMF, cold plunge sauna. What you have was different. And so I'm so
Yeah.
interested to learn more about why you selected what you did and how it helps you define what longevity means, because we know people don't just want to live longer, but they want to feel vital and feel good into their later years.
Exactly.
think that's something that was so amazing watching my dad's career growing up is he would bring people into our own home to live with us, and I got to see these people actually age in reverse. And
Wow.
it was a few people that I saw based on them living with us, and I was a young child, so I
Mm,
wasn't going with him to the office every day. But now that we're in practice, it's really cool to have these equipment that can even further that, like expand on that for people. And we actually have measurable tests where we can watch people age in reverse, and we watch people walk out just looking a lot healthier, looking a lot younger, feeling better. So it's really, really awesome to see.
I
Oh,
was
by the way, you could measure aging now.
Tell
We
us
can
how you can do
we
that.
can measure biological aging, yeah. So with these new DNA tests we have available, we can not only check for occult cancers and see if
Mhm,
people have some hidden thing that we have to treat before it manifests itself into something serious. We
mhm.
could use in
Yeah.
we can impact it with nutritional excellence to reverse it before it manifests itself into a florid cancer that could be
Mhm,
life-threatening. But in any case, the new testing modalities now available enable us to check like what's these little things that could be off in your body, including what is your biological age compared to your chronological
mhm,
age, and what's the aging of your brain compared to the rest of your body, and how
yeah,
have you destroyed your lungs in the process. You know, we can
mhm,
actually see where the aging is taking place, what organs are affected the most,
yeah,
and compare. So you may be 60 years old, or you may be 50 years old, but you may have the body of a 65-year-old. You may be
uh-huh,
40 years old with the body of a 20-year-old. In other words, we can really see this. And what Cara was saying is we can actually measure the reversing of the aging process. Because people would say to me through my life, I'd say to them, they'd say, you can't age backwards, you can just age slower. And I'd say, well, that's semantical terminology because if we measure your biological age based on telomere length and DNA and
mhm,
epigenetic changes and methylation defects,
mhm,
and we see after a period in part starts this program for 6 months, if all these biological age parameters get in the reversed, the person's actually younger, um, we're actually are reversing backwards, aging backwards. So the high blood pressure goes away, the diabetes goes away, and just me, like I'm in great health, but since we have some of this regenerative equipment, I went from 68, age 68 to 72, and over the years, over that 5-year period,
uh,
I had to go down in weights a little bit in the gym.
sure.
So I'm not look maybe 20 pounds less instead of benching my body weight, maybe 20 pounds under my body weight. So I'm not quite as strong as I used to be.
Mhm,
But since I started this stuff that I'm doing that we have in the practice,
yes,
I'm back up past the weights I used to lift when I was 68 now. I went back up and I can do more than my body weight now. So and I
incredible.
can do now I can do like more chins, more push-ups. You know, wow, this is like cool, you
And they're
know?
saying,
Yeah.
what is
Mm,
it? Strength and
mm,
muscle, is major when it comes to longevity.
yeah.
So my question for
And
you
but
is,
body fat's
yeah,
more important.
is it body fat?
Yeah. Well,
Okay.
it's a combination. You wanna be strong,
Uh-huh.
but you gotta have a low body fat. There's no such
Low
yeah.
body fat.
Yeah, there's no such
Yeah.
thing as an overweight, healthy person. So people have got to eat right and exercise both. But what we're saying, we're helping get that ratio, get the fat down and the muscle
Mhm.
up, you know?
My question for you is how quickly do you see this reverse aging, and what is the protocol or what are the steps or the plan that you put your clients on to kind of see your desired result?
Well, of course, it's customized to the individual, you know, so it's not just one plan, but the portfolio. The thing to remember here is that the 6 foods, let's say, that have the most documented evidence in the scientific literature to prevent cancer, right? The 6 foods that you want to include in your diet regularly that are very powerful. We can describe that the power is incredible.
Mhm.
Like, for example, women who ate 10 grams of mushrooms a day reduced risk of breast cancer by 64%, you know, in large scale studies. So the power, very powerful food against cancer. But those same foods that protect against cancer also protect against heart disease and
Mhm.
dementia. It's not like one diet for cancer and one diet for heart disease and dementia. It's the same thing that ages us slower and makes us live longer. But then the individual differences that we can identify through blood tests and more evaluation of the person
Mhm.
allows us to make more subtle tweaks
Mhm.
where a person might need, let's say, something like NAD or glutathione or more. They're not absorbing
Yeah.
something well that we
Mhm.
ascertain on a test. They need more of a maybe their homocysteine is elevated. Well, there's
Mhm.
some kind of individuality we have to make adjustments for.
Sure.
You know,
I love going into like everything he just said, especially because of all the testing we can do is also great motivation for people. And we do a lot of motivational coaching when we're talking to patients about how they should change their lifestyle. I tell
Mhm.
them it's, really an identity change when you join this way of living and to live in your best health.
Mhm.
And we always share with patients that there's four main parameters of longevity and increasing your health span.
Mhm.
And the first one is going off of what he said with the food is nutrient density in your tissues.
Mhm.
And we always want to look at that. We actually have a machine that can look at, it uses a laser to look at the color of your skin to see how many carotenoids you have in the body, which are antioxidants. So we use that for patients to look where they're at and we can see where they're going in the future. The second parameter is toxicity in the tissues. So as your nutrients go up, your toxins go down. And we're also able to look at toxins in the tissues through the DNA methylation testing that we use because it can show us how much PFAs are in the blood, which are those forever chemicals that you get from things like pots and pans or makeup. It also shows you pesticides or environmental toxins. It even looks at someone's like alcohol and drug and smoking history, which is really cool. So we can look at toxins in that way. And then the third one is body fat percent. So he already went over that. And the fourth one is your omega-3 index. So we always test everyone's omega-3 index to make it individualized to them because everyone can convert a different amount of fatty acids into the brain from what they eat, but it's at a different level for everyone. So I love going over that with patients as well.
Right. So we adjust this. So some people need more supplemental omega-3 than other people based on their ability or inability to convert the short chain omega-3 ALA into longer chain EPA and DHA. So yes, you need it, but how much do you need? Some people need hardly any and some people need a lot.
Right. Yeah. And I think coming in to see you to get the baseline with the blood work and these genetic methylation tests, is that what I did when I came in and saw you?
So you did the carotenoid scan.
The carotenoid scan.
Where you got to see how many
Yes,
antioxidants you have in your skin.
What was her number?
I think you did an in-body as well.
I
Where
did
you
an
saw your
in-body,
body fat
yes.
percent, so we get that data and you see how much muscle you have compared to fat, which is really cool. So you did all of that.
I did.
I don't remember what your number was though. You asked. I don't remember what it was.
I don't want to put her on the spot and embarrass you too
I
much.
don't memorize my patients' values.
Yeah.
And it's funny that if people's numbers are too low, they're fatigued, they have headaches all the time, they're sick all the time,
Yeah. I mean, it's, we're like, we don't know where to begin. There's some people just taking supplements or vitamins because they think they need it, but I think it's so helpful to come in, get the blood work done, do these tests with you to get a baseline for where do we begin? What should we start incorporating into our lifestyle? I loved this G bombs. I had never heard that before from the Nutritarian handbook. Can you tell us more about G bombs?
Sure. G bombs are quite simple. It's the 6 foods that have the most protection against cancer we want people to include every day. I was doing a commercial. The actress was on Taxi. She has an incredible memory. So she says, well, why don't you come up with why don't you come up with an acronym? So we said, okay, GOMS, So then GOMS, well, I gave her the foods that have the most protection against cancer. And then we went home and I said, no, G bombs, GBOMBS, greens, beans, onions, mushrooms, berries, and seeds like flax seeds and chia seeds.
Yeah.
So the question is, did you have flax seeds or chia seeds on your breakfast today? Did you put some wild berries on there?
I did.
You did, yeah.
I had oatmeal with berries and seeds.
And seeds, yeah. So then do you have some mushrooms every day in your food? Do you eat some cruciferous greens, either both raw and cooked? Do you put some sprouts or arugula on your salads? So these little tweaks, and what's so amazing, even in small amounts, have incredible dramatic effects on a person's health. Like, and it gives you one example. They tracked women with breast cancer for 10 years. They already had breast cancer. And they tracked how many lignans they ate. Now, keep in mind, one tablespoon of ground flax has 21 milligrams of lignin, and 1 teaspoon has 7 milligrams, okay? So these women who had a third of a milligram of lignin a day compared to none had a 71% reduced risk of dying of breast cancer over that 10-year period. There's no chemotherapeutic agent. There's no drug that can reduce risk of dying of breast cancer by 71%, but a pinch of flax seeds does it. It's of lignin. It's so amazing, some of these things. And of course, we're putting the portfolio of these things that work synergistically together. So it's not just the flax seeds. We're giving it with the mushroom, with the red onion, with the sprout, with the, with all these things. But people have no idea of the power of nutritional excellence, that when you combine all these things together in a diet, it's the answer that people have been looking for to not to have to worry about getting cancer. And they think that they've been just, you can say, brainwashed into believing the wrong things. Like mammograms are going to save them. You know?
We don't know where to turn. There's so much noise. There's so much information out there. Eat this, don't eat that. Oh, wait, now it's good for you. Now do this. Eat steak, don't eat steak. It's like, where do we even turn?
Yeah.
And this is where I think your Nutritarian approach really comes into play. How would you, for those who've never heard of it, explain what it is and how maybe it differs from a plant-based diet?
Yeah, it's more specific. So Nutritarian means super healthy. I'm on a super healthy diet. I'm a health nut, And I'm eating to not, so I don't have to worry about getting
Mhm.
heart disease or dementia or cancer. I know what causes that. I know I can live my life. Don't have to worry about that. I want to
Mhm.
enjoy my skiing, tennis, mental challenges. I
Mhm.
want to enjoy my life, you know? So attracting people who want to protect themselves in their future by what they're doing now, not waiting until they
Yeah.
have some serious disease down the road, but do it now while they're well.
Mhm.
And I have, hundreds of thousands of Nutritarians around the country, around the world who are,
Yeah.
taking modern nutritional science and applying it into their life.
The
Right?
nutritional
Yeah,
science,
they're just
healing through
yeah,
food.
right.
And one thing that I read that I loved was if you want to lose weight, don't diet.
Mm.
Why are we against dieting?
Well, it's the whole concept of diet
Mhm.
because what we're saying here is focused on the quality of the nutrients you're consuming. Because when you take in these nutrients and your body is nutrient satisfied, including with the fibers and the green vegetable compounds and the compounds and the sterols and stanols and nuts and seeds and the amount of nutritional, you could say resistant starch from beans,
Mhm.
when you get these, they're natural GLP-1 inhibitors. They reduce your appetite. They get you
Yeah.
instinctually connected with the amount of calories you need. So you're not on a diet. You're eating them.
Mhm.
I don't diet as much food as I feel like
Yeah.
eating. But the amount I feel like eating is controlled by my diet,
Mhm.
by the healthy food I'm eating. And when people just try to willy-nilly cut back on calories without paying specific attention to the quality of what they're eating,
Mhm.
then they increase their food cravings and they're always going to be yo-yoing their weight up and down on and off some crazy diet.
Mhm.
And when
So
people who are
true.
food addicts and they're significantly overweight and you fast them or cut back the calories too far, it has them more obsession about food in their brain.
Mhm.
And they lose weight and they're going to gain it back again. And they're going to start to binge. They get
Yeah.
in these binge and dieting cycles. We're trying to get people out of that cycle and start eating for
Yeah.
your future health is the best because whatever weight you lose is of no benefit unless you keep it off for the rest of your life. So unless you can adapt yourself to a diet that you're going to
Mhm.
stay with, a style of eating that you can stay with forever, there was no point in making the change.
Mhm.
So we got to learn how to people learn. We want people to learn how to eat for their long-term health and stay with it
Mhm.
permanently.
And there's a science behind it.
Yeah.
Let's talk about peptides and GLP-1s. Curious what your thoughts are on GLP-1s and potentially if there perhaps are long-term effects we may not know yet or be thinking of because they're so new.
Right. Well, I have a unique perspective on it. Even some of my colleagues will say, "Oh, let people do it short term, and then they'll go switch into healthy eating." And I'm saying there's no benefit to short-term benefits. 80% of people are off them in a few years. The weight comes back, and any benefit you got is worthless if you came back again. And and the other thing is you don't. If you follow people out 5 years, they're not going to be better because they sped it up at the beginning.
Mm.
Don't forget a GLP-1 only loses about 10% body weight. So let's say a person weighs 250 pounds, they should weigh 150 pounds.
Mhm.
Or they're a woman who should weigh 125 pounds and she weighs 200 pounds. So she's 75 pounds overweight. The GLP-1 only loses 10 pounds, 10% of her body weight. She only loses 20 pounds. She was 75 pounds overweight. She's going to be 55 pounds overweight. What good is that? She's going to stop losing.
Mhm.
And if she stops the drug, she'll go back to gaining the 75 pounds back and more.
Mhm.
So it's just not it's better than nothing, but it doesn't have anywhere near the efficacious
Mhm.
long-term benefits of learning about what we do through Nutritarianism and supplying the body with the optimal nutrient exposure and having people be able to lose the full 75
Yeah.
pounds of being overweight,
Oh, yeah.
and then be satisfied and stay living at 125 pounds for the rest of your life without yo-yoing your weight up and down, you know.
And I heard I think it was there, we have natural GLP-1 within us, and there are certain foods to eat or certain ways to activate it.
Yeah, absolutely. So when you eat things as my dad was just saying, like
Mm.
greens, beans, and nuts and seeds all together within one meal, it's
Mhm.
actually more effective than the drug
Mhm.
because it's increasing your satiation and you're more satisfied with what you're eating, so you're able to eat less. And one thing that I love saying this and I love sharing with people that a lot of people in the world, they think they need to eat to not become overweight. Like that's the mentality is you're eating a lot of enough food you can like to not become overweight. But we like to live by the mentality of to eat enough food to not become underweight. And that different mentality
Mhm.
is able to happen when you eat the right foods. So when you eat the greens, beans, nuts, and seeds together all within one meal, you're able to do that because you're so satisfied and it keeps you full for so long. Like a lot of the times I eat that for lunch
Yeah.
and I can't even finish it, so I finish it for dinner. But you're just actually shocked at how little food you actually
Mhm.
need when you're eating the right foods.
Eating the right foods combined together is something we're
Yeah.
not taught and we don't think about.
Absolutely. If you removed the beans from that,
Yeah.
it wouldn't last. It wouldn't work.
Wow.
If you removed the nuts and seeds, it wouldn't work.
The
It has
greens,
to be
beans,
everything
nuts, and
together.
seeds.
That combination.
And maybe some berries.
Of course,
That-
berries in the day, but
Yeah.
You
and
don't have to do the same
you don't
meal.
have to do it within the same meal. But those three things together within the same
Yeah.
meal.
You could have some
is really
mango or some
important.
cherries or
Yeah.
something.
Yeah.
Yeah.
But what's really cool is that people think GLP-1 inhibitor is like a drug or some agonist, but that's just a copy of what the body makes. It's a hormone made by the body. If you're eating right, you make all that yourself, and the drug isn't going to do what the body can do.
Right.
The body is more effective than the drug. When you have your own your body's own insulin is better than taking insulin from a needle. Your body's own stuff is the best.
This
You just have to-
system,
Yeah.
when treated properly,
Yes.
will operate to maximum efficiency, but we're trying to find workarounds.
Yes, exactly. And what Cara was saying too is that it's almost impossible to become overweight when you're eating the right foods because you're so satisfied, you don't feel like eating
Right.
anymore. You know, it's sad, and you're getting the fiber with bulk fiber. But the point is that it's just demonstrative of how insane our current society is. That almost everybody is overweight, and everybody is sickly, and every person over the age of 60 is taking medications for blood pressure, and every person is getting there's just so much sickness and so much pain. And people think, oh, my osteoarthritis, my joint pain hurt because I did so much exercise. They don't realize it's all nutrition, and that and even that we could anyway. It's just
But what do they want more than anything is to feel well.
Yeah.
Why how have we gotten to where we are today?
Well, it's so sad because a lot of people think it's bad luck when they get a disease or when they get like something really bad happens to them. They're like, oh, it's such bad luck. Like, why'd this happen to me? Everyone thinks it's not going to happen to them. But when you eat a standard American diet, the diet that's designed to have candy, pizza, white flour, and you're going to get standard American diseases. That's why it's happening to so many people is because we're all eating the same things. And when you change that, you won't get those diseases.
and then we have the medical profession and the health authorities, which don't make things better. They make things worse. It makes people think that it's like a religion where they believe drugs is their answer for every solution. Like your blood pressure looks okay because I'm on 3 medications. So it's just a permission slip. It's like the medical profession becomes the enabler. It's like trying to tell people it's okay to keep drinking your alcohol. They enable people to think it's okay to eat a dangerous diet because now their cholesterol looks okay with the drug. Now their blood pressure looks okay with the drug. Now their diabetes is well controlled. But they're still 40 pounds overweight. They're still, they don't recognize that. But in any case, most of what doctors do, not emergency care is valuable, but treating chronic illnesses with medication instead of with scientific nutrition and regenerative therapies, we consider like malpractice. It makes people age faster. It's destructive. And now we have that's one of the reasons why we have some of the equipment we have in our practice too, because we don't even want to expose people to radiation. Now we're testing people, and we're going to so-called prevent breast cancer deaths by radiating their breasts, where dense breasts suck up more radiation, with something that causes breast cancer. And that's the best technology we can do to detect breast cancer. So the whole thing is backwards and based on money, and not based on equipment and money making. And they don't want to retool when better equipment becomes available. It's all just.
We don't question the system.
We don't-
think,
right,
oh, okay,
yeah.
the doctor prescribed me, great. This is my solution. But wait a minute, what if I can take matters into my own hands and pay attention to what I'm putting in my mouth, how I'm moving my body, how I'm thinking?
Yeah, right.
It takes a lot of time to educate people and to show them their options. And I think a lot of doctors just don't think they have the time. And so they do what they learned in medical school and just everything's by the
And
book.
they do what's standard. Yeah, it's called, by the book. It's by standard of care. They feel they're protected from being sued if they just do what other doctors do, and they don't deviate from the norm. Even so the medical profession that's most accepted and respected is at least probably 10 or 15 years behind where the times of what's best for us to do right now.
At least.
Yeah.
At least.
So I want you to get into, Dr. Cara, when I came in to see you, you talked to me about the whole mammograms and how, women are having the radiation on their breasts, thinking this is going to screen for breast cancer. Talk to us about what you offer at Longevity RX and how it differs.
So I think it's important to understand a little bit of how breast cancer screening works in order to understand this amazing technology. And in conventional screening, what happens is that when someone gets a mammogram or an ultrasound, a targeted handheld ultrasound, or an MRI, and they see something that's abnormal and they want to go for further testing, the doctor will send them for a biopsy. So I feel like a lot of people have heard of that. A lot of people are sent for biopsies because the images aren't that clear, especially for someone that has dense breasts, which is very normal. It means they have more tissue that produces milk when you're breastfeeding, or for someone that has implants. It's hard to see that on these technologies. So a lot of the times these people are sent for biopsies or rescanning actually. And when you go for a biopsy, the pathologist is looking under a microscope to see what the tissue is, and they're looking at if it's abnormal or not. But there's no way to tell under the microscope when you're looking at dead tissue whether it's abnormal and going to cause harm in your lifetime, like will shorten your lifespan, you should get treated for it, it's aggressive, or if it's something that looks abnormal, but it's just never going to harm you and it's completely benign. You don't need to do anything about it. You're able to live a long, healthy life with that. Or maybe you want to change your diet and eat more flax seeds, eat more mushrooms because there's something that's just not really aggressive and you can do it with nutritional standards. So what's happening is that both of these cases, the abnormal and aggressive or the abnormal and benign, are being treated the same. They're both going for chemotherapy, radiation, and they're a
Mm.
patient of medical care. And these treatments are really detrimental to someone. It's putting them through all of this mental gymnastics of
Mm.
so many scans, so many tests, and then a diagnosis that they have to suffer through. It's very stressful on them and their family, as well as the treatment increases the risk of cardiovascular disease, which is one of the leading causes of death. And it also puts younger individuals with which breast cancer is being diagnosed a lot younger. So it puts younger people in early menopause.
Mm.
So then they have the low libido, the vaginal dryness, the mental fatigue, and all of that. So that's what's happening right now in conventional care. And one of the reasons that we actually opened at Longevity RX is because of learning about all of these things and learning from cancer conferences that there's actually a better way. And we were so excited to learn what that better way is. There's something called QT imaging, which is what we have at Longevity RX. And it has 248 ultrasound cameras within the device. So instead of getting your breast smushed by a plate, you're actually laying
Mm.
face down on a table and your breast is laying in a water bath. And these cameras are going 360 all the way around in the water to get a really clear image that's actually 40 times more clear than an MRI is and 20 times more clear than a mammogram. So the image is really clear. There's no radiation and it's really good for people with dense breasts or implants because it doesn't affect the quality of the image. And what's so amazing is that it actually removes that step to go for biopsy. So, with QT imaging, since there's no radiation and the image is so clear,
Mm.
we can calculate something called lesion doubling time. And that's how fast an abnormal mass grows within the body. So, something that's, as we talked about before, abnormal and
Mm.
benign, it's not going to change in size. And if it changes in size, it's going to be negligible.
Mm.
Some of it can even get smaller. And if it is a cancer that's aggressive, the abnormal and aggressive case that we talked about before, that's going to double in size within about 120 days. So we can actually repeat the scan to see how alive tissue is growing. We're not looking under a microscope to look at dead tissue that we can't distinguish aggressive or benign.
Mm.
We're looking at live tissue to see how it's responding in the body and if it's doubling in size quickly or not. And that's what makes QT imaging so amazing is because it takes out that unnecessary treatment for that 30% of individuals. It's about 20 to
Mhm.
40% in studies of individuals being overtreated for breast cancer. It removes them out of the equation as much as possible.
Yeah. That's what I was going to say, that term, and that percent again. So what we're saying, to make it clear, is that when women go for a biopsy, that we're pretty much in agreement that that radiologists disagree on the findings in about 40% of the cases, but at least 30% are being overdiagnosed. That's the word,
Mm.
overdiagnosed, thinking they have a life-threatening disease, living with the anxiety and fear of they have a life-threatening disease, and they never needed to be treated. So by using our QT imaging, which is much more accurate at identifying serious disease, but not identifying things that are not serious and calling them serious, it's more accurate,
Mhm.
that it removes at least 50% of women having to go for the biopsy that's now going to be
Mhm.
30% inaccurate. So we're only going to send people for biopsies, things that are more suspicious,
Mm.
not the things that are not growing fast.
Mhm.
So it takes, we're saying, reduced amount of women needing biopsies by at least 50%.
Wow.
That is huge. When you think about
Huge.
the hundreds of thousands of women getting biopsy and getting
Mhm.
fear and being scared and being, And then they're radiated
Right.
and getting chemo for something they never needed to. And those things cause, like Cara was saying, radiation and chemo can cause other deaths. So even though, so mammograms and this whole movement of, saving your life with mammograms and having the pink ribbons,
Yeah.
it doesn't really show that the population is living longer. It shows breast cancer deaths go down a little bit, but other causes of deaths go up to make over and above the reduction of breast cancer deaths. So it's overall a wash. We're not making women's lifespans be longer because the overdiagnosis and treating people needlessly is causing other deaths, and plus the fear involved. So now with the new technology, obviously, you could reduce breast cancer deaths and not have the overdiagnosis and the problems and increasing other causes of death. So and taking each individual woman and taking the chance of having fear and breast cancer diagnosis into her life.
And something so cool about the technology that you just made me think of is we actually had the unique opportunity to go to where it's invented in Northern California and see their whole warehouse and meet the person that is the mastermind behind this
Who
machine
invented it?
and who
Yeah.
invented it. And what I love is being behind a piece of equipment that is constantly being updated. They're constantly working on the AI technology to even make it a little bit better.
Yeah.
They're not just saying, okay, we made this 50 years ago and we're going to keep it what it is. So I think
The
that's really
speed
cool
of
too.
sound is one thing that identifies this technology too, is that the speed of sound means that when you get a dense breast in a mammogram, everything looks white. And you could have a 3D, a better quality mammogram with more radiation, but it's still like looking at a polar bear in a snowstorm. It's still just trying to look deeper in something that looks white. With the speed of sound technology, with the QT imaging, you can actually see the speed at which the sound wave goes through the mass to the other side, and it's registered. And different tissues, cysts, fibroglandular tissue, cancer, all has different densities, and the measurement gives you a number. It's numerically calculated, and it's not operator dependent. It's all done by AI. So we get much more accurate measurements. So not only do we not overdiagnose and misdiagnose, but things that needed to be found that were missed on a mammograms, you could actually see on a QT, you know? So it's just a completely much more advanced technology. But the current medical thinking is not going to take out their $50 billion investment in the present technology and dump it all and then put these expensive $1 million machines in instead. They're going to be 20 years behind the times, you know?
So I'm grateful for Longevity RX. We
Yeah.
can become the pioneer of our own health. And really,
Yeah.
I've heard you say like control outcomes when it comes to our health and to cancer.
I think people should control outcomes before they even get tested for anything. Why are we waiting to get tested to control outcomes in the sense of you can live a healthy lifestyle before you have a diagnosis? So many of my patients don't want to change their lifestyle until they have something like cancer or high cholesterol, or they're extremely overweight, or they have really bad rosacea and they have psoriasis because their skin is freaking out. Like there's a reason that people change their health style, like lifestyles, and want to live in good health. I think that everyone should live in good health before they come to see me, and they should learn how to live in good health by seeing a doctor, not say, I have this reason for coming to you. What can you do to fix me? But yeah, there are a lot of things we can do to motivate people in that way, like giving them specific screenings, like doing the antioxidant score we talked about. And like we have really advanced blood panels. So we have one blood panel that we take vials of blood for. I call it a liquid biopsy, and I've had people think it was an actual biopsy. So it's actually a blood test. And we're looking for a protein that's an early detector of cancer. So we're testing for that protein in the blood, and they're telling us you have a DNA methylation defect that is likely of cancer or it's not. And if you have a positive result, we can go down then the next steps of figuring out where that cancer is coming from or if it's cancer or not. But it does give us that tool to help people get diagnosed before they actually have something very severe. And you can reverse that with nutritional excellence early on in their life rather than waiting until it gets
Yeah.
to be too late.
Here's the
It's funny.
echoing theme. Don't wait until something's wrong.
Yeah, we would want
Start today.
everybody,
Yeah.
including all children, teenagers,
Yeah.
everybody should be living a super healthy life and should have less need for doctors and medical care and healthcare.
Right.
You know, they have less need for doctors. But of course, a lot of people they're not motivated to make the change until you show them something's wrong. So we can do the blood work and evaluate them and say, yes, you have these problems. And then they'll be willing to listen to us and make the changes to show us if we could reverse them. But we would love a lot of people to make the changes when there's nothing wrong with them.
Don't wait.
Mhm.
Don't
Well,
wait. There's not something
not
wrong with you.
all of us grew
yeah.
up with you as our father,
Right.
Dr. Fuhrman. What
Yeah.
was that?
Right.
I will say, I also did have my own rebellious phases. It's a
Did
joke
you?
between the
Yeah.
two of us that I was probably the most rebellious out of all of my siblings. I'm one of 4. And I'm the only one who is now a doctor doing exactly what he does, just because the nutritional excellence really speaks for itself. I myself had really bad acne, which, it could be more severe with all we're talking about, things like cancer and heart disease. And I had really bad acne, and my dad said to me, you don't eat how I tell you to eat. And if you do, your acne will go away. And being a vain high schooler who wanted to not have cystic acne all over her face, I said, okay, I'll give this a try. And I stopped getting off the bus and going to my friends' houses for cheese sticks and hot dogs, honestly, and started listening to him and saw just my whole life transform. And then, of course, I watched his patients transform. But it is something that I do think a lot of people, with how strong the mainstream media is on convincing us to eat candy and hot dogs,
Yeah.
there typically is something that has to happen to someone for them to want to come to this side. But we're here trying to preach to people to learn from other people's stories. Don't allow your health to get there.
What do you see are some of the biggest mistakes you see high achieving adults make when it comes to their health?
I would say right now, specifically electrolytes, and a lot of people making the mistake of just trusting trends on social media and thinking that something that feels good immediately can lead to long term benefit, because a lot of things that feel good immediately actually lead to long term detriment. It's
But to
not.
make that clear, we're saying not to take electrolyte
Yeah.
drinks, not to
I would-
take electrolyte drinks. She's saying electrolytes is the most stupid, most crazy scam and
Yeah.
myth.
I may have
Yeah.
fallen for it.
Actually putting more,
We
adding
can
more
talk.
salt onto your high salt diet. Add
Yeah.
more salt. That's going to want more risk of stroke, because obviously the major problem here is hemorrhagic stroke. So yeah, I mean it's just crazy what people are doing. They're
I know.
creating a higher risk of stroke and dementia. People don't realize that salt doesn't just raise blood pressure. It also causes tau proteins that cause Alzheimer's disease to overdevelop. So it speeds up the rate at which you're losing brain function and weakening the interior lining of the blood vessels in your brain, increasing the propensity of them to actually break open and hemorrhage into your brain, causing a premature death. In the Seventh-day Adventist Health Study 2, the plant-based eaters, the vegans, had higher risk of stroke than the meat eaters did, because the lack of cholesterol thickening the basement membrane in the brain, meaning that salt becomes even more damaging to a person on a healthier, more plant-based diet than a person who's eating, chicken fat or something. But so there's a lot of new problems that people aren't real aware of.
And I feel like that's also to say that it's not healthy to eat salt and take electrolytes when you're eating meat.
Yeah,
It's just.
we're just saying yes, definitely. You have to know all these nuances
Yeah.
to know that you can still have this problem on that diet if you still do that wrong. But there's a lot, there's a lot of things people are doing wrong today.
And to further go into that question, I think one thing in the world today that people don't realize is how to read research. And a lot of people think something like the keto diet or the carnivore diet is going to cause them to lose weight, and they want to stick with that. Like, I'm just going to lose weight. But they don't realize it's also going to lower their chances of living a long, healthy life, and it's going to decrease their mortality. So we like to say hard endpoints versus soft endpoints when it comes to research. And a soft endpoint would be something like losing weight or getting your acne to be clear. But a hard endpoint would be something that leads to mortality. So is it going to cause a shortened lifespan or a longer lifespan? And that's the most important thing to look at when it comes to research. And that's really what I think sets us apart from other clinicians, is that we have a full-time PhD nutritional researcher on our board. I consider my dad a full-time PhD nutritional researcher as a doctor, and I'm learning how to do that as well. So really knowing how to read research is important.
Yeah. So I've written many books,
Right.
but we do have a staff behind us too. We have, like she was saying, Dina, who works, all she is a nutritional researcher who never sees a patient. She just scans the literature to make sure what we're doing is state of the art and has all the data behind it. So what we're doing is proper and correct and supported by the science.
We're in great hands.
Thank you.
I'm curious from each of you what you believe the biggest change one of our listeners could make in terms of their long-term health and longevity, and why.
My answer is lunch.
Lunch.
That lunch should be, if everybody in the country changed their diet to eat this lunch, they would reduce healthcare costs by more than 50% of all causes of death. And it's that have a salad with not just lettuce, but with something cruciferous like arugula or bok choy or kale with the salad as well, with red onion and maybe sprouts, and then use a dressing made of nuts and seeds, which is so protective against cardiovascular and cancer deaths. So the dressing wouldn't be oil and vinegar. It might be, you know, it might be tomato paste or sun-dried tomatoes with almonds or sesame seeds with balsamic vinegar and roasted garlic. The dressing itself is super healthy. And then some vegetable bean soup and some fruit for dessert. So can you imagine if our whole country had a giant salad chewed really well with some vegetable bean soup and some fruit for dessert instead of, because the lunch is the meal where they go out and they're exposed to work side and, food out of the house. And if the whole country ate that lunch, that would be the massive change. What do you think?
Of course, that was gonna be my answer
Yeah.
as well, because that would be the best thing, but I'll expand upon that so I'm not copying in
Okay.
the sense of just eating your G-bombs, like, having that acronym be the forefront of every meal and thinking,
Mm.
"How can I add something in the greens, beans, onions, mushrooms, berries, and seeds list to this meal right now?" And then to also for people to just look at their plate and say, "How can I make half of this plate green? How can half of this plate be really colorful and really, just extremely bright and from the earth?" And then I think also another thing that came to my mind is if just everyone stopped eating fried food.
No more French fries.
Yeah, it's just a lot of fried food in this world.
Yes.
Like, just remove it.
Yeah, fried food is pretty
Yeah.
dangerous.
Where are you most excited to see this longevity movement go? Maybe there are some machines, some practices that we're kind of on the forefront of that maybe many of us aren't even aware of yet that you're excited to see come into play.
I think the combination of everything we're offering at Longevity RX is what makes it so exciting because there's nowhere in the whole country, the whole world that has all of this in one space. So we have, as my dad was saying, we can help people in any sort of pain.
Mhm.
And to give an example, I had a woman come in who couldn't walk because her legs were just really weak. She had restless leg, and it was a very unique case where no one really knew what was wrong with her, but doctors told her for some reason she was never going to be able to walk again, and that's what she came in telling us to do. So we put her on a combination of equipment that she now walks up and down our halls and is like feeling amazing. And so having the combination of equipment that can, break up calcifications and scar tissue to heal any sort of injury you may have had, and then also couple that with equipment that can use electromagnetic cellular stimulation to change how cells are communicating with each other in the same time is just so helpful for people to no longer be in pain. And when you're no longer in pain, you're able to focus on things like your diet and your exercise routine because you're not just sitting there being like, I
Sleep
can't
better.
do anything because I'm so
Mm.
in so much pain. And then coupling that with our educational, like just teaching people about how to eat is really where the money's at. So we can do all of these different things for people so that they can really increase their health span.
Yeah, it's almost like we've taken over like orthopedic surgery from the orthopedists now. They don't need to have shoulder reconstruction. And people are doing carpal tunnel surgery on people with wrists. And we could fix that with our machines really fast. And the cartilage, so
Mhm.
we're doing all types of invasive therapies that aren't needed anymore.
Mhm.
That we can do this regeneratively to get rid of an arthritic shoulder or to get rid of a bad wrist or a tennis elbow or something or a bad back. We could, so it's really
Mhm.
cool.
And the
You
equipment
know,
even surprises me every day, actually, because I had a patient that came in for an osteoporosis treatment. So we were putting her on a bone repair sequence
Mhm.
to help increase her osteoblasts, which are those bone building cells.
Mhm.
And she actually had an injury in her ankle and some wrist pain. And from just treating her bones for osteoporosis, she told me for the first time in 3 years, her ankle and wrist pain has also gone away. So,
Incredible.
yeah. So the answer to your question is also that, what is our objective and where do we want this to go?
Mhm.
I've been this doctor for decades,
Right.
and I've had produced books. I've been on television. I've been in the public, you know. But the point is that we still get personal satisfaction from just seeing one person get well.
mhm.
It's so rewarding to just help a person who has psoriasis or help a person who has some condition get rid of their headaches. The point is that it never becomes boring, and it always becomes rewarding when you're helping people. Because if you're doing something that works and you're transforming a person's life so they're feeling better, it's personally satisfying.
Mhm.
Mhm. Yeah, at conferences to go off of that, we've been to a lot of conferences recently since I
Yeah.
started my career together, and I've had a lot of people come up to me saying, "I was diagnosed with cancer 14 years ago, and I became a Nutritarian. I'm 14 years cancer-free. I had stage 4 cancer all because of your dad's work." Like, just hearing those stories is where we want this to go.
Yeah.
We wanna hear more
Yeah.
stories
More
like that.
stories.
Yeah.
Yeah, yeah.
Food can heal you. It can
Right.
also make you sick. And so pay attention to what you're eating because you are so passionate about this approach for a reason. Dr. Joel, you've devoted your life to studying this, to helping others. And I'm so grateful you now have Longevity RX open just minutes from here. I can't wait to come and dive in even further to all of your offerings. Is there anything we didn't cover that you'd like to bring into this episode or leave our listeners with today?
Just that I think they'll find that we're really proud of what we put together because our staff is so warm and caring.
Yeah, I think that was something that's really amazing that we were able to find individuals on our staff and our employees to really want to see people do better and give to our patients just like we do. And one thing that I was really passionate about, I know you too, was to create a space where people could feel like comforted and relaxed rather than somewhere where they have to feel stressed when they're getting something like a breast scan and just make people feel like they're in good hands as they're healing.
I didn't want to leave. I loved my amortal. So I say
Yeah,
amortal
immortal
Yeah,
chamber.
chamber.
yeah, right.
Yeah.
Tell our listeners what
Did you
that
do
is.
that?
I did.
You
I
did it?
Yeah, she
Okay.
loved
tried it.
it.
Right.
Yeah.
That's cool.
The Immortal Chamber is amazing. It actually has 5 different modalities, and so all in one. So it has our red light, which everyone knows and loves. It has PEMF, which is like a recharge of the cells. And then it also has acoustic sound and vibration, as well as nasal hydrogen, which is a really potent antioxidant, and guided breathwork and meditation. So the machine is just you kind of like a time warp of I feel like when I go in it, I all of a sudden wake up. I'm like, oh my God, my session's over. It was 25 minutes later
Yeah.
because it is a forced time for meditation. And that has profound effects on the body. It can help people like with high stress jobs to reduce their stress. It can help reduce inflammation. It can help people with so many things that it's an amazing piece of
It's
equipment.
combining all these anti-aging new technologies into one
Mhm.
25-minute session. Otherwise, you'd have to go to 5 different machines simultaneously, and simultaneous work. That's what I was referring to when we first started talking and saying, like, "I have nothing wrong with me, but I can exercise more, I can lift more weight because 'cause I've been going in that machine 3 times a week," you know? And it's like, wow, it's crazy what I could do now.
It's
Yeah.
incredible. I didn't want to leave. It's very
Mm,
futuristic.
yeah.
Mhm.
Where can our listeners find you, follow along with your journey and all that you're creating with Longevity RX?
You can find us for Longevity RX at www.dr, short for Doctor, Longevity RX. It's LONGEVITYRX.com. And then we're both on Instagram. We have our Longevity RX page, which is at Longevity RX underscore. He has his Instagram, which is at Joel Ferman MD. And then I have mine as well, which is at Dr. Cara Fuhrman, and the doctor is just DR. So those are all the places you can find us.
And you
I
can
love
find
to
us they can just go right to everyone knows where the post office is in Rancho Santa Fe, and they can just go right next to the post office. We've got that spot, so everybody could find us really easily. You can
yeah.
walk right in and say hello.
Yeah,
Yes.
we actually
Mm,
took the place of a pharmacy, and I
mm.
didn't realize with our name being Longevity RX, people come in thinking we're just the pharmacy with the new name, and I'm like, "No, the prescription is not the drugs, it's longevity, like health medicine."
Catch up, guys.
Yeah, we're not actually a pharmacy.
Yeah. Oh my gosh.
But, yeah, I love to post too on
Yeah.
Instagram, like everything I eat to help
Mhm.
people even from their own homes, not just coming into Longevity RX,
Yeah.
but of course, we would love to see people at
Mhm.
our space and show everyone these amazing technologies.
Well, thank you to each of you for being pioneers in this space. I'm so grateful to be connected and can't wait to share this with our listeners. Thank you for coming on.